Are you suffering with jaw pain, headaches, TMJ? We're going to do a little bit of a deeper dive today into TMJ. So for those who don't know, TMJ, it's a joint here between your skull, your temporal region, and your mandible, hence the term temporomandibular joint. We're going to talk about a lot of different reasons why your headaches, specifically around there, may not be getting better, what some of your options are, what not to do. A lot of people just think they should just either take an aspirin or a Tylenol and then it doesn't go away. Is there something else we can do? So we're going to break that down for you. There's a lot of things that you can do, a lot of different causes that maybe many of your doctors may not look at. So we want to kind of get that all set up for you. So again, basics, TMJ, little joint here, in between the bottom of your skull here, kind of around your sideburns if you're a guy, hopefully not a girl, and then attaching to your mandible there. What we want to do is, first thing obviously is understand the symptomatology of it. What you want to do is understand how to understand what's the pain is coming from, where you may feel the pain and what you may need to do about it initially. So initially, some people will definitely just have pain right in that specific spot, but you can also have pain that radiates up into the skull here, especially on the sides of the head here. You also may get pain down into the smaller muscles of the jaw, we're going to get into in a little bit. Buccinator, masseter, the pterygoids. All those are smaller muscles that help your jaw move, and they can get affected from a lot of different things, which we're going to detail in a second. You may get some pain even on the bottom of the jaw. Some people may not be able to open their jaw widely. Sometimes you may hear that cracking noise where you open your jaw and you hear that popping or cracking noise when you try to open your jaw and you feel like kind of that your jaw trying to reset. A lot of times that's not actually the TMJ itself. That could be because of damage to the little disc, because there is a little disc in there, similar to what you have in your back, but much smaller. That could break down, and then you have almost bone on bone on your jaw, or that could be because the upper part of your jaw, which is your maxilla, and the lower part of your jaw, which is the mandible, are not lined up. That could be from one of two main reasons, either obviously from above, where because you grind your teeth or your posture or the way you sleep at night, they don't line up appropriately. Or it could be affected by the muscles below. You have tons of muscles that work on your jaw that come from below. You have a lot of muscles that come here right from the top of your sternum. They have all these complicated names like sternohyoid and sternothyroid and thyrohyoid. And they kind of make it simple where they're coming from and where they're going. But you have a lot of small muscles that go here into the bottom of your jaw that definitely, if they're tight from poor posture, or even the way you breathe at night, if you're a mouth breather at night, or from even doing too much chest presses can tighten up those muscles, and if you're not breathing the right way, can lead to poor motion of the jaw and eventually making these muscles work too hard and causing pain that simulates TMJ pain and a lot of muscle, facial, and jaw pain. Other things you want to be wary of, again, patients who do grind their teeth at night, that can definitely lead to pain because you are overworking these muscles in here, the buccinator, the masseter we talked about before, and those can definitely get inflamed and be problematic. Other things, gum repetitively, eating it all the time, hard candies, sucking candies, hard food like chips. So those types of foods can definitely affect you. If you've had some type of head or neck injury from sports to a car accident, that just doesn't affect here. Like the song says, everything's connected. So if it's something that involves a head injury, that's going to mean that the ligaments and the muscles are not lining up with the jaw and it can lead to jaw pain. We're going to even consider pain here into the cheek area, kind of in that same ballpark. Other things that can do that, as you mentioned, snoring, sleep apnea, people who grind their teeth at night, people who have even a forward head posture because of the stress it puts on the forward of the front of the musculature. All of that can lead to problems with jaw and TMJ. So it's not just grinding your teeth, the thing that most people hear about. It's not something, okay, here, just put a bite guard in and you're going to be fine. A lot of times it's more complicated than that. You want to treat all the different things that are going on and try both prescription, non-prescription, and some appliance type things like a bite guard. In some cases, if you are grinding your teeth, the bite guard, because of the way it works on resetting the muscles, it'll help the muscles relax in the jaw. It can be helpful for some people. For some people, it can exacerbate the condition. In most cases, it is helpful. It may not completely take away all your complaints because you're not fixing all the problems that we discussed. You have the muscular component, which it may not help, especially below the neck and the jaw, because those muscles are not as helped as much from the bite guard. If you have snoring, sleep, all the things that we detailed, those have to be addressed as well. So those are things you want to be aware of when dealing with things like TMJ and jaw pain. I am an osteopath, which I am a doctor, prescribe medications, do injections, do all those types of things, but I'm also much more in tune and have no special techniques to help relax the muscles in the joints. And that's things that you want to work on as well when we're talking about treatment here, which we're going to go into now. You can put ice if it's the jaw area, because that there's swelling in there. When we're talking about more pain in the cheeks, especially if it hurts where you can't open your jaw completely, or you can't even puff your cheeks out with air, that's probably more a muscular issue, and that you'd want to put some very light heat on initially to calm the muscle spasm down, and then maybe do some alternating with ice, because there is some inflammation in there, but a lot of times the heat is going to work better there. You want to make it a little lukewarm to not burn yourself. Use common sense in that regard. And then also you can definitely there are some stretches that you can do to help work on the posture here in the neck and in the upper chest to help reduce the muscle spasm. That could be things like up dog, that could be cobra, that could be just doing some pec stretches in the doorway, and other things that would be more personalized by your physician. Again, these are definitely questions you want to discuss with your dentist or your physician or your orthopedist, whoever's been treating your condition. Those are very simple things that you can do. Then we get into medications. Again, ibuprofen, if it works great for you and you're taking it occasionally, that's great. It's not something that you want to be doing every day, because then your body will get addicted to it. You can become addicted and have overuse syndrome of both Tylenol or ibuprofen or Advil or Aleve. So it's something that if it works, great, but it's not something you want to be doing every day. There's a lot of other things that we now are starting to use for it. You can use a muscle relaxer occasionally. Again, they have major side effects. They can be sedating. That's something you want to be doing every day, but an initial part of your outbreak, something you definitely want to pay attention to. Then we get into, there are now more pain creams. And if it's something more superficial, especially here in the cheek or under the jaw, things that you want to look at. There are basic ones like arnica. Works pretty well for a basic complaint if the pain is more severe. I know most people find it hard to believe. I have to mention peptides in almost every video I do, so we're going to do it here as well. You can definitely get creams of BPC, BPC with KPV, BPC with GHK. All that could be applied locally in any area of the face that's bothering you, and that can definitely, because they're all anti-inflammatory in nature, help with the pain. You definitely can get improved by getting a massage for some people who know how to adequately do jaw and upper network. If they don't know how to do those things, it's not something you want to be the guinea pig for, because it can make you worse and trigger worsening headaches and pain and lack of motion. Other things that we can do is osteopathic manipulation, where we can go in there, stretch the muscles, we can go in there and adjust the neck, which may help. We can actually adjust the mandible and or the maxilla, which is the top of the jawbone, or the base of your skull, which also, depending on the posture, if everything is connected. If you're bent forward, it's putting pressure on the base of your skull here, and if you're bent backwards, it's the same thing. It's also putting pressure on the muscles here in the front. So it's something to be aware of. Getting those types of manipulations and getting some myofascial work can definitely be helpful. You can also do craniosacral, which is an overlap of massage or chiropractic or an osteopathic. That has also been shown to be very helpful. The things with massage or craniosacral that allows you to do work intraorally, meaning in the mouth. It may sound scary. When you're having it done, if you've never had it done, it is painful, but it does work incredibly well. It's probably the way that you may get the most instantaneous release and relief. What you can do is you can work on these muscles and actually adjust the jaw itself by going inside the mouth. The doctors or the massage service is using gloves, and what they're going to do is work on the 4 or 5 different muscle groups. They're going to work on the masseter and the buccal center, both from outside and inside. These are muscles that help the jaw mostly go up and down, a little bit side to side. And they're going to work on the above and below the tongue. There are small muscles, the hypoglossal and myoglossal muscles below the tongue. Believe me, when you work on it, it is going to hurt. You will get instantaneous relief when those muscles are released. It happens, again, a lot of times in mouth breathers. It also happens in patients who are forward head posture people, which unfortunately now in our society are a lot of people, but it's just something that you just get instantaneous release from. The other areas that we're going to work on are the pterygoids. The muscles back in here. They're backed by the molars. They can be released. That is probably the most painful component of doing some type of intraoral treatment. You may actually start tearing because of the nerve that's above it, but it does work really well, and you want to work on the medial and lateral pterygoids, and that's the muscles that help your jaw kind of go side to side usually, and that's something that if you do all 4 or 5 of those muscles together, you usually will get some relief. Then if that's still not providing adequate relief, first you want to make sure that you can work on the TMJ joint itself, which you definitely initially would want to get x-ray to make sure there's no arthritis in there. You actually can get an MRI of your TMJ to see if that disc that I mentioned is degraded. What can happen if it's not degraded or degenerated, like in your back, it can actually, like a herniated disc. You can get a herniated disc in the TMJ joint here, where it can push forward or backwards. And there are some techniques where we can actually manipulate the jaw and hopefully get that disc to go back in. If that doesn't work, you can get injections into the the jaw itself, either with cortisone, but that can be degrading to bone if you're doing it for a prolonged period of time, or you can do PRP, which is platelet-rich plasma, which is deriving from your own blood and taking the healing cells in there and injecting it back into the joint. You can actually also inject it back into the muscles as well. That has a lot of promise to it, much less side effects. Understand when you do PRP, you may be more sore for a day or two, and then you will notice much more relief. There are people who actually do peptide injections into the face as well. If that you are going to pursue any of those types of treatments, you want to make sure you're working with someone who has the knowledge and knows how to do these procedures and feels comfortable, and probably should be doing it on ultrasound so they can visualize exactly where they are. And then all these can be combined with, again, the aforementioned bite block. That is something that you may need as well. You may also need something to monitor yourself if you're grinding during the day. Speak with a dentist. There may be some type of dental procedure involved depending on how the jaw is actually lining up, and work on your posture as well. And all these techniques combined can definitely help you out a lot with your TMJ and the jaw pain. So if you like this and the other videos on the channel, please like and subscribe.